This series is brought to you by Ecotrin, the #1 cardiologist recommended aspirin. Welcome to How Aspirin Works. This video is specially designed to help you make informed healthcare decisions and to supplement information from your healthcare professional. I am Dr. Adam Rosenbluth, a non-invasive cardiologist. You've probably heard a lot about aspirin, but with all the talk these days, it's hard to separate facts from fiction. That's why I'll be discussing aspirin, its uses, and how it works. By the end of this video, you'll be better equipped to ask your healthcare professional about whether aspirin is right for you. Remember, aspirin is not for everyone, and you should not start aspirin therapy without first consulting your healthcare professional. The risks and benefits of therapy vary for each individual. Now, let's get started with a brief overview. Aspirin is a non-steroidal anti-inflammatory, or NSAID. That means it reduces the aches and pains associated with inflammation. Aspirin is a relatively inexpensive, easily accessible drug that is often regarded as the most successful non-prescription medicine. It's available in more than 80 countries and can be found in all major retailers. On the actual label of aspirin, you'll see the drug facts about aspirin's uses. For example, aspirin is an analgesic, a drug that reduces pain, so it's used for headaches and minor aches and pains. It's an antipyretic, which means it's used to reduce fever. Plus, it's an anti-inflammatory, so it's used to reduce swelling and is also used in the treatment of various rheumatologic diseases. But that's not all. There are several well-researched uses not written on the actual package label, but in common usage and supported by robust clinical studies. These include the use of aspirin for heart health. In fact, numerous studies in the United States and abroad, including those shown here, have evaluated and verified the effectiveness and safety of aspirin for heart health. For example, aspirin can reduce risk of death in patients with suspected acute heart attacks. Aspirin can also prevent recurrent heart attacks. Plus, aspirin can reduce risks of heart attacks or sudden death in patients with chest pain. That's why the American Heart Association recommends that people at high risk of heart attack take a daily low-dose aspirin if told by their healthcare provider to do so. Similarly, aspirin may be recommended to treat strokes and other conditions. Different strengths and forms of aspirin are recommended for different conditions. For instance, for daily heart health, low or regular strength may be recommended. But for pain and inflammation, higher doses may be recommended. For heart health, enteric-coated pills are most frequently recommended by cardiologists for patients who take a daily aspirin, since it is safety-coated and protects the stomach. Now that you've heard a bit about aspirin, let's see how it works. First, it's important to know that oxygen is carried through the body by red blood cells moving through blood vessels. Platelets, which are small cells in the blood, help red blood cells to group together. This gives blood its thickness. The vessels may be narrow due to fatty deposits on the wall of vessels, known as plaque. Essentially, aspirin hinders the action of the platelets, helping blood cells move more freely through sections of blood vessels that may be narrowed. These are powerful effects, and aspirin is a powerful drug. That's why it's so important to know the facts and speak to your healthcare professional. While occasional use for aches and pains and fever is generally safe for most adults, daily use can cause serious side effects. Therefore, speak to your healthcare professional about the benefits, risks, dosage, forms, and possible use for you. Thank you for watching this video. Please visit ecotrin.com for more information and videos in our series. I am Dr. Rosenbluth, wishing you the best of health.